I'm Ben Keane, owner of Keane Spark Electrical and an AD Business Insurance.
We need a photo. We'll commence in just a few seconds. Just a lot of people just coming in at the last the last minute by the look of things. Okay. Good evening and welcome. I'm Jen Alden, the Mayor, City of Greater Bendigo. I'd like to welcome you to the Bendigo Business Forum. And first of all, acknowledge that the City of Greater Bendigo is on Dja Dja Wurrung and Taungurung country, acknowledging and extending appreciation to the Dja Dja Wurrung people, the traditional owners of the land that we're meeting on, and today pay our respects to leaders and elders past, present and emerging, for they hold the memories, the traditions, the culture and the hopes of all Dja Dja Wurrung people. We express our gratitude in the sharing of this land, our sorrow for the personal, spiritual and cultural costs of that sharing, and our hope that we may walk forward together in harmony and in the spirit of healing. As we move forwards towards the end of our second year of COVID, we have high vaccination rates in Bendigo. The community is to be congratulated. 95% or more first vax dose and over 80% second dose. So well done, everybody. However, it comes as we're in the midst of a COVID outbreak in Bendigo, and at the same time as the border with Melbourne is about to be relaxed. So it's an ever-evolving landscape and set of circumstances and regulations and especially considerations for business. And there's a bit to discuss. So I'm going to hand over to Chair of V Bendigo, Marika McMahon, for the evening. Thank you, Marika.
Thanks, Jen, and welcome everyone. Jen, if I can join with you in acknowledging our traditional owners as well, and if I can also welcome everyone to this forum, which has been put on this evening on relatively short notice so that you and us, the business people of Bendigo, can hear from some of the experts in our area regarding the current COVID situation, what we might face in the future, and some expert advice around the roadmap and the steps that we need to take. I'm sure you're in exactly the same position that I'm in with my business of constantly looking at regulations, looking at exposure sites, and always trying to think, how do we look after our clients, our customers, and our staff? So terrific that we've been able to pull together this group of people this evening to not only give us a little bit of an explanation, but also to take questions as the evening progresses. Format, we're only going to take up an hour of your time this evening, but hopefully be able to disseminate some really useful information. We have 3 speakers who will be giving short presentations of about 10 minutes each. Then at the conclusion of that, we'll have some open opportunity for questions as well. During the course of the presentations, you are able to put questions in the chat box down the bottom on your screens. I don't know why I'm saying that. We're all probably used to Zoom by now. Questions pop down there. There are some staff from the organisations who'll be turning to answering those questions while presentations are continuing, if it's something that can be answered quite specifically. Other than that, there will be about 20 minutes at the conclusion of tonight's discussion for people to raise specific questions so that we can manage the logistics of this with 61 participants currently in the room at the moment, and probably more increasing. Just ask that you do keep your microphone on mute during the presentations. If you've got a question during the presentation, as Daniel has already done so, pop that in the chat box and we might be able to address that specifically. Otherwise, questions taken at the end, and I'll be doing that on the basis of, raising your hands through Zoom will be the way to do that. And I suspect a lot of our questions and queries will be the same. So hopefully they'll be addressed in the presentation, and if not, there'll be some common themes towards the end. Hopefully we've covered off on that, but really tonight's an opportunity for business in Bendigo to ask questions from the people who have the experience and qualifications to be able to answer them, so that we can all get on with our business and hopefully alleviate a little bit of the pressure in running businesses as well. So the first presenter this evening is Dr. Bruce Bolam. Bruce is the director of the Loddon Health Unit. Bruce is right there in the centre of Bendigo's response to COVID. So Bruce is going to take us through the current situation for Bendigo. Hopefully it'll mean that we can explode a few myths, but at least have a straight from the public health, Bruce, your direct explanation of where Bendigo is now and what we'll be facing in the weeks and months to come. So over to you, Bruce.
Thanks, Marika. So I'll share my screen with you now. That's just going to take me a moment to bring up. Can people see that all together, I hope? So I'm going to step you through a little bit of the detail of what's happening. But before I do so, I'd like to thank everybody on the call, firstly for participating tonight and all of the great work that's been happening so far in our community. I'd also like to acknowledge the traditional owners of the land on which we're meeting in our various locations, and acknowledge also Aboriginal elders of the past, present and emerging, and the fact that Aboriginal community here in Bendigo have been playing a leading role, of course, for many years, but particularly during this last COVID period in supporting community, engaging with community and keeping ourselves safe. So currently within Bendigo, we have seen a significant increase in cases. We currently have, since the beginning of this month, and as of 24 new cases yesterday, a total of 256 active cases currently within the Greater Bendigo local government area. Sorry, 256 cases to date, and then 218 active cases currently. The reason we say active cases is, of course, as people go through their quarantine period and they end that period, obviously they stop being an active case. We currently are seeing also in that graph, what you'll see there is the blue is the number of new cases that have happened each day. The green is the number of new households. As outbreaks go along, as they move along, what we see is, of course, every time we get a case, Often what happens is that the immediate household people are the closest contacts. They often turn into cases themselves because of that close contact. As outbreaks progress broadly, we normally see the number of new households start to decline. As you can see from this graph there, you can see we're still getting a pretty large number of new households within this. So we would anticipate seeing new cases continuing to come through in Bendigo, for some days, possibly for some weeks. We know that obviously we're moving away from a situation of attempting to eliminate COVID entirely in our community. That's no longer our goal. Our goal now is to try and keep it as low as it can be while allowing people the maximum freedom to practice their everyday lives and, of course, their business practices as much as we can, while keeping it very, very low in the community as far as we can do. Moving to the breakdown of the cases themselves, this is a chart showing the male and female, males in blue and females in the kind of orange, burnt orange color there, by age group. And what you can see is, because of the success of our vaccine program, and the mayor was just mentioning, over 95% total vaccination coverage for at least one dose in the over 16s, and 80% for that same cohort. What we can see is that there's a very small number of cases in the over 60s currently, or indeed in the over 50s. The vast majority of cases we're seeing in the outbreak to date are in the under 40s category. Of course, that is the group where our vaccination levels overall are the lowest. And the reason for that is that these cohorts have had the least length of time to get vaccinated. These are the groups where vaccination is comparatively new relative to the over 50s and over 60s. So continuing to push through our vaccinations, and we're doing roughly 1,000 a day vaccinations just through our Mollison Street site for Bendigo Health, let alone through general practice and pharmacies throughout Greater Bendigo. We've still got a lot of vaccines to deliver to get that rate as high as it can possibly be, particularly for those younger cohorts. The good news here is that there is a significantly lower risk, a lower level of severe disease in younger cohorts. So broadly, it gets really the severity of hospitalization and of risk of fatality is in the vast main concentrated in that over 60s group, particularly when there is pre-existing illness. So keeping those numbers as low as they are in the over 60s is a definite boon at this point. We are seeing a large number of cases compared to what we've seen in the past, but we know that over time, COVID is going to be an endemic disease. And as long as it remains in that under 40s group, I think we can take a lot of comfort from the fact that in the vast main, those cases will be mild to moderate. And while we do, of course, have a hospital in the home program, and we monitor those people who do have pre-existing medical conditions and so forth to ensure they keep safe, in the vast main, that should keep a lot of pressure off our local hospital system. Turning then to the cases by postcode, we can see this is a map of Greater Bendigo by postcode. And the color indicates that what you can see there is a very broadly widespread distribution geographically across Greater Bendigo. The vast majority of areas within the largely urban areas have got cases. And in particular, we see a higher number of cases in Kennington, Kangaroo Flat and Golden Square. But when we look at those areas, yes, they are relatively higher, but the case numbers themselves are still comparatively low. We're talking 20, 30 cases. So rather than, 50s and hundreds of cases. So there's a little bit of variation there, but broadly, this just shows that we've got a fairly widespread distribution of the current new cases. In conclusion, I'd just like to kind of tilt into also exposure sites. And this, of course, becomes very important for business in particular. So we've identified currently over 850 close contacts. We call them primary close contacts as the technical jargon associated with this outbreak to date. 850 different people who've been exposed to the virus, have a high likelihood of having been directly exposed to the virus. Every single one of those, when we do the interviews, generates exposure sites. It generates a list of contacts and a list of places that potentially there could have been exposure. And currently we've got 22 exposure sites. Just to give a sense of the range that we're talking about, we've got 14 in educational settings, everything from early learning and upwards, 12 in retail settings, including gyms and supermarkets and many other services, 7 in healthcare, aged care or residential care, and 6 in hospitality settings such as cafes, pubs and hotels. So as we all know, we're not as routine now publishing via the the Department of Health website, every single exposure site that we identify. We've shifted into an approach here where we're working with businesses, we're working with all of those different industries to identify cases and identify their contacts as rapidly as possible. If there is a significant risk to that there is a lot of people who may have been exposed, who otherwise we wouldn't know about, of course, that will continue to be published on the Department of Health website. But with the great work that's been happening in businesses right the way across Bendigo, we're really comfortable with the fact that people are keeping good records, they're doing QR code scanning, and that if we need to do additional follow-up activities, we can do that in partnerships between obviously the contact tracers in the team that we have at the Public Health Unit here at Bendigo Health and with the businesses concerned. So we're not routinely publishing those, not that they're basically because we're seeing that as much more business as usual now, and we're really just reserving that publication when we think there is a significant unmitigated risk to public health that we need to prompt public awareness around. To conclude as well, I mean, I think firstly, it's important to recognize just how tough it's been for business, not just, of course, because of the closures, but the complexity of the rules, the changing nature of the rules make it very difficult for businesses. And we absolutely in the public health unit completely appreciate the pressure that puts business owners under. The good news is that those rules should over time gradually get easier and simpler to implement as we get into a more COVID normal way of working. The bad news is more change and constant change, unfortunately, will continue for some time, and a return to full normal at least isn't here for, I would say in my professional opinion, at least for a couple of years yet. Things like mask wearing in certain circumstances, hand hygiene, keeping physical distancing going in certain circumstances, those things are going to be here with us for quite some time. So I'm kind of on behalf of public health, I thank you for your efforts so far, and I apologize for the inconvenience to your businesses in these changing rules. But to indicate some of the positive changes that I think are happening, I will dwell on some of the more significant changes that have happened before we go on to other speakers. In particular, changes to quarantine requirements, which mean that now fully vaccinated people who are close contacts of a case and that don't live with a case now don't have to quarantine for 2 weeks. That's been reduced to 7 days, and they can be reduced following a negative day 6 test. Now, what that means is less furloughing of staff, we hope. It means less people being kept out of the community and participating in everyday business activities. Also, for close contacts living with a positive case, we only need them to quarantine for 14 days, and they don't have to have their quarantine extended should anyone else in the household become positive. This is this issue of we've had often in households as the infection spreads, gets rolling quarantine requirements, and that can have a really significant effect on furloughing of staff. So this shift of the rules, again, is public health defensible, but it also makes business a lot more predictable, we hope, in terms of furloughing of staff particularly. And finally, household secondary contacts, those are people who've been in casual contact and no longer needing to be quarantined. So if someone's been to an exposure site or worked in an exposure site, the people in that household who haven't been there no longer need to quarantine in the same way as they have previously. So while changes will be occurring, we hope that the changes that will occur in the main will mean a less onerous impact on business. Certainly that is our intent, and we work very closely with our Department of Health colleagues and everyone else from DJPR onwards to try and make this as easy as possible, recognizing how challenging it has been and will be for some time for Bendigo businesses. So that's it from me. I thank you.
Thank you so much, Bruce. I don't know, we'll hear from others later, but I certainly really appreciated hearing that directly from you, that just a little bit of a sense of relief, whilst it's not necessarily an easy path forward, at least there's a path forward, and it's really comforting to know the expert epidemiological, etc. approach regarding how should we be thinking about this current case level. One little measure that the public health unit mightn't be using in their analysis is, for the last 20 months, I've kept a keen eye on the number of cars parking in Queen Street. And I'm pleased to say that today I had to drive up to the car park to get a park. The car parks are starting to fill up on street level, which I think is a nice little measure for Bendigo. Our next speaker today is Barbara Cullen. Barbara is, and excuse me, this is a long title, the Director, Industry Sector Engagement from the Department of Jobs, Precincts and Regions. And Barbara's going to talk to us about the roadmap, business settings, COVID-safe plans and support available for businesses. So Barbara, welcome to our discussion today, and over to you, particularly keen to hear things from the department perspective.
Thank you so much, Marika, and it's lovely to be here in beautiful Bendigo. I've got family in the area too, so don't think they're here. I'd like to start by respectfully acknowledging the traditional owners of the land on which we're virtually meeting today, and I pay my respects to their elders past, present and emerging, and the Aboriginal elders of other communities who may be here today. Roadmap. We've had lots of announcements, as Bruce has said, lots of information to keep up to date with. On Friday at 6 o'clock, we'll be moving to a new statewide setting where regional Victoria and metropolitan Melbourne joins together again, finally. And that's what's called Phase C in the national plan, on the roadmap to delivering Victoria's part of the national plan. As we know, the settings will ease, including density and capacity limits on premises. If your staff, you and your staff are fully vaccinated and your customers or clients are fully vaccinated as well, masks will remain mandatory indoors, but we no longer require them outdoors. Yippee! Masks are highly recommended where people can't keep that distance from each other. And every business, as we know, must have a COVID-safe plan. Please keep it up to date. Every time you hear of an announcement or a change to directions, please pull out the COVID-safe plan, have a look and see if it affects your business and, if the directions changes affect your business. Talk to your local council, talk to your business advisors, talk to your industry groups and be Bendigo especially, to see if there's any information that needs to be updated in your COVID-safe plan. Update it and talk about it with your staff. And I might talk about that later as well. Thanks, Fran. So from Friday at 6 o'clock, most indoor settings, including restaurants, pubs, gyms and hairdressers, will open with one person per 4 square metres, and only if all the staff and all your customers or patrons are fully vaccinated. Most outdoor settings will be at one person per 2 square metres, up to 500 people, clients, customers, I guess if they're outside, patrons, where staff and patrons are fully vaccinated. We had some really good news today from the Department of Health that clarified the setting and the requirements for general retail, and that is that customers attending general retail, and there's an example there of a clothing shop, or essential retail, for instance, a supermarket, will not be required to show proof of being fully vaccinated. And that's at this stage. We don't know what's down the future path, but at this stage, from Friday evening, you will not have to show proof of being fully vaccinated to enter retail. And on the website, and there's a link that we can provide later, if not in the presentation, that actually tells you what general retail includes for this purpose. It doesn't include hairdressing or personal care services or beauty. Workers in general retail and essential retail are required to be vaccinated by the dates that were specified in the mandatory vaccination directions. And there's the full name of it. And that's the 26th of November. So it's really great that we got this clarification today, because I know that people are preparing to open on these particular levels and these particular density quotients from Friday evening. And it was a really vital piece of information that we needed, because otherwise you would have had to accommodate someone doing that checking. But for now, we don't. Thanks, Fran. There's lots of new posters available for you to help you when you are checking your staff and your customer vaccination status. Change of colour on the posters. You might notice that it's I think a dark blue or a black, and it's a big shift from the kind of aqua green that's currently around. These are posters that help you, and this is one of the guidance pieces that helps you understand the types, or you and your staff, help you understand the type of information that you might be presented with to verify someone's vaccination status. And Fran has put the link in the chat there as well for everyone, which is the link to the resources that's online. Thanks, Fran. And there's also in the posters the steps and in the guidance, the steps to help you download the proof of vaccination status. And it's linked to your my Victoria, Service Victoria app. And you get a very nice little moving coat of arms. And you also get the multicoloured Viva Victoria as well on your app. So there's the steps that you need to go through to create that account and make sure that you've connected your certificate from your double vaccination to your Service Victoria app and your check-in, your QR code check-in. Thanks, Bran. As Bruce talked about, there's a great new approach to close contacts in the workplace. This is really, really welcome news as well. It does really help those businesses with shifts to accommodate shifts and people where they maybe have been exposed. So this is a really much more practical approach, we think, and there's lots of information on the website, and it is a risk-based approach, and there's a matrix that you can look at to determine as well and help you make those determinations about whether someone is a close contact, or like a first contact or a secondary contact. And it does help with that, keeping the roster a little bit more flexible for you, especially when you take into account you might not have fully vaccinated staff that you're trying to accommodate as well, but in some other part of the business, but not they'd be working from home, not from the work site. It talks about, and as Bruce said, the primary close contact required to isolate for only 7 days if they're fully vaccinated. So another incentive to be fully vaccinated as soon as possible. Household and unvaccinated primary close contacts are still required to isolate for 14 days. And there's more information on the Business Victoria hotline or the coronavirus.vic.gov.au website. Thanks, Fran. Lots of information here for you, posters, the roadmap, the links to the roadmap, and as we've found that the roadmap gets updated whenever there are questions, Fran, we could go back to the other links, or the Great Ocean Road if you like. I guess that's it. Thanks. We'll
I lost the presentation. I shall
lost it. Okay, that's okay. What we'll do is I will send the presentation to here we are. Oh, we're back to Rachel and colleagues so that they can share you this presentation, and you've got those links to click through as well. There is a link there to the business grants and support that was flagged. There was an announcement a couple of weeks ago by Minister Pulford, who announced the new package of business support that's available, mainly a lot of top-up grants for people under the funds. And there's a new video on how to add the vaccination certificate to your Service Victoria app. I'm not sure if the links are actually live there, but Fran, before I send that, I will make sure that they are. And certainly lots of information on having conversations with your staff about getting vaccinated if that's something that you need to do. And I must recommend that the Department of Health has put together a fantastic Champions program to help you have discussions and to answer questions about vaccination. And there's a video that I'll pop in the link as well that is it's a recording of one of the webinars where I think it's Ben Cowie, Professor Cowie is answering the questions, all the questions about getting vaccinated. So that's always really helpful as well for people. And I believe also that I think fairly recently, it might be just from today, that the Service Victoria app, where you have your check-in, your QR code check-in, and your vaccination certificate, it's also now updating to include a new feature that notifies Victorians who have the app, the COVID QR code check-in app, that they have checked in at a Tier 1 exposure site listed on the coronavirus website. So that's a fantastic new feature of the Service Victoria app. So that's another reason to download that app and use it to help with the contact tracing and to minimise the spread of the virus. And I think that's all for me, but very happy to take questions.
Terrific. Thanks, Barb. We will take those questions at the end. Our third speaker, I know we have some people who had joined us a little bit into the presentation. What we're doing is having the three speakers and then the opportunity for some questions. There are people popping questions in the chat at the moment, which we're either able to answer or at least gather some themes of questions together for the discussion at the conclusion. Our third speaker this evening is Sue Tomlinson, also from the Public Health Unit at the Loddon Mallee Public Health Unit. And Sue's role is largely around the contact tracing and the activation of the unit regarding cases. And Sue's going to talk to us about the current processes for business when a positive case is known. So thank you, Sue.
Thanks very much, Marika. I'm hoping you can hear me. I tried to turn the camera on, but it's having a little hissy fit. So apologies for that you can't see me.
No problem, Sue. The sound's coming through fine. Thanks.
Excellent. Thank you. Yeah, we've done a few changes in the workplace exposure space, but primarily from a contact tracing perspective, it is very similar to how we've been doing it all year. So we get notified of a case. Once we've done that, we would interview that case, we'd find out where they worked or where they attended, anything that we considered high risk, and that's possibly where the changes have been more recently, in that, as Bruce mentioned, we're not necessarily identifying Tier 2 exposure sites anymore. So we do a bit of an assessment with the case themselves to see how long they were in a space, whether they were wearing a mask, sort of how close they were to people, how big the space is, and we make a decision about whether or not we move forward in contacting that business. So then we would find out your number, or you can almost guarantee it'll be an after hours number request. If it doesn't happen on Saturday, it never happens at all as far as I can tell. But we chase around looking for that if it's not obvious, and we'll give the manager or the supervisor or whoever's number is available a call, and we sort of start the process. And it basically starts with a hi, really sorry to have to tell you that you've had a COVID case visit your establishment, or that you've got a staff member that works there. The general concept with that is certainly if it's a staff member, we obviously require to identify the staff member. We do that for public health reasons, because it would be very difficult for you to do any contact tracing if you didn't know who the positive case was. When it's a customer, it's a little more difficult, and it just depends on how easy or hard that is to do that identification. So it might just come down to times and dates for determining when the customer was in the site and trying to identify from a business perspective the contact tracing. So the one thing that is good recently with that is they've developed a matrix which we now have access to, that with the contact tracing helps you determine who's at high risk, who's at low risk, and who's at medium risk. And it means that instead of previously just about everybody that was in the area would isolate for 14 days, and now that we've got this matrix, we're able to risk assess against the people in the room or in the space, depending on how long they've been in contact, whether they were wearing a mask, how close they were to the case. So obviously that social distancing conversation about within 1.5 or outside 1.5 metres, whether you had physical contact, and how big the space is and how long people were in the space. So if you're sitting in an office that's not very big, not well ventilated, and you're in there for an hour, you may end up as a high risk, even though you haven't actually come within 1.5 metres. Having said that, the high risk and the medium risk and the low risk does change on your vaccination status. So that piece just sits in the background. So once we determine the type of contact, then we can add the vaccination status in, and that might reduce the risk to the people as well. So we walk through that sort of process. We provide the matrix if you require it. And we determine that. I think the other thing that we often do, and certainly is the question is, do you need to close? So the answer is not anymore. It's not an automatic closure perspective. So what the expectation is if the person that is positive was in a particular space and you're able to close that off and clean it, then you can close that area off, do a COVID-19 clean, and you can keep the rest of the business open. If it's been over 72 hours since the case last attended, again, you can, as long as you have daily high touch cleans in traffic areas and you have ability to do high touch cleans in that space, again, you don't need to. And then the third one, I'm just looking for where I've written down the third one, is if you do daily routine cleaning of high touch areas in your traffic areas, and that's where they've been. But those sorts of things are all on the website, and you just have to have a look at those when you go. I don't know if people have seen it. I'm not sure whether we can put the link in, but on the Exposure Sites website, right down the bottom, so underneath the map, because people often go to the map and don't go further, is the Tier 1 business information, and that's where the cleaning is, and it explains it much better than I probably am over the Zoom meeting tonight. But I think that it's a good thing to note that it is no longer an automatic closure. So if you can get around it, then that's a good thing. We will ask for the contact tracing list, and that's so that we can then place people into our system. We can provide them with whatever the support might be, whether that's once they get into our system, we get SMSs, we can then refer them to the financial assistance. If they don't, if they're not in our system, then it's very difficult for them to access those. They require reference numbers and things like that. And it also means that we can keep an eye on clearances and provide them with that information as we go through for contacts. So we will ask, and we usually send an Excel spreadsheet, and we do ask that you fill it in, but primarily what we need is the name, first name and second name, date of birth, a phone number, preferably their mobile if they've got one, and then the last day of exposure. And that becomes an issue if you've got a staff member that's worked perhaps for 3 days you'll find that somebody worked with them on Wednesday but didn't work with them on Thursday or Friday. Other people worked with them on Friday. So you may find that when you're doing that contact tracing that the last day of exposure is a little different depending on who's worked when. But we do that because their 14 days start, or their 7, depending on vaccination status, starts when they've had their last contact. So I think primarily that's how it goes. If you do close, you no longer have to provide a certificate of cleaning to open. You just have to abide by the COVID-19 cleaning information, which will be in most of your COVID plans anyway, I expect. I think the other thing I'd like to mention, which has changed more recently, is that when cases are diagnosed on their testing, they actually receive a text message from the pathology. So what we're finding now is that staff members ring their business, or regular patrons will tell the business or the area that they have been in that they're a case, and you start to look around and wonder what on earth you're supposed to do next, because nobody from the department has contacted you that yet. And that's because actually we don't necessarily know right at that minute. So there's that little lag time now that the cases are getting an SMS where they're aware of it. They may well be telling people, which is not, perfectly reasonable. And as a business, you may well know that you have somebody in your workplace that's positive. So all I can say is the best thing to do, there's 2 options. One is obviously read the Tier 1 guideline for business at the bottom of the exposure site page and just work your way through, knowing that we will come. We will certainly call you once we've interviewed the client and worked out where they work and do the risk assessment. The other is that you can reach out to the public health unit. It's just depending on the timing and the information that you have, it's a little bit hard to be 100% sure exactly how that will work, because, as I said, sometimes you can get notified informally and sometimes you get notified formally. So I think that covers the vast majority of stuff. Thank you, Marika.
Terrific. Thanks very much, Sue. And I think if we put that information together with Bruce's information, I think a key message for Bendigo businesses is, we have had a nice little bubble for a lot of the COVID journey, but now that we do have the high vaccination rates but opening up, I think we are moving to a stage now where the approach of business should be, it's not if we are affected, our workplace is affected by COVID, a COVID exposure, but it's when it happens. I've spent a bit of time looking at those links that Sue was talking about, and in particular, the link there on the front page of the COVID exposure site, where you click on My Business is a Tier 1 exposure site. That link's been shared here as well. Really useful exercise to spend half an hour having a look at that and thinking about it for your business. It is, if you prepared your COVID plan some time ago, it's quite different regarding closure, opening, notification, and what's involved in cleaning. And I actually found it, pretty useful to go through and see that it is actually less onerous, and to also have that thought of having a look at it before it becomes something that you actually need to deal with in reality. So urge all of you to have a look at that. Thank you so much to our 3 presenters for your very efficient delivery of your content, which now gives us the opportunity to look at some questions. So while our participants are gathering their thoughts regarding questions that they'd like to ask, and if you could just use the hand raising function in Zoom to pop up a hand, I'll turn to your question, but I'll pull together a couple of the threads of things while you're doing that that's in the chat. Obviously, a big area where people have questions is around vaccinations and hospitality, and in particular, what are those rules in this, dare I say, sort of crossover time at the moment, where we've had one arrangement in regional and then that's moving, we have the 6 p.m. Friday happening. So Wendy had asked, what if a staff member is still awaiting their second vaccination on Friday, but booked in for the second one? Does that change what they can do work-wise, or does it change the density requirements for the business? So I think that's probably Barb to answer that one.
Thanks, Marika. Yes, I was actually just replying then to one of Wendy's previous questions. It does. Only fully vaccinated staff are able to work on site. Therefore, you might find something else for that person to do while they're waiting out their vaccination or bringing it forward, if they can. Only fully vaccinated staff operating. If you are unable to roster on any fully vaccinated staff at all, then you may have to choose to revert to a previous setting, which is takeaway for, because we're from 6 p.m. on Friday, we'll be at Metropolitan and Regional Victoria joined together in the one settings. The setting is that if you cannot provide staff to help in the hospitality setting, then it's takeaway for customers, for your business only. You can't offer partially vaccinated staff in a fully vaccinated customer setting, and so you will have to operate as takeaway for that duration. Similarly, and I think this was Wendy's other question, was that if you have customers who are partially vaccinated or not you can't verify their status, and you've got fully vaccinated staff, so you're operating as sit-down service indoors and seated indoors, yes, and outdoor people as well, you can only offer that customer takeaway service. They cannot, unvaccinated or partially vaccinated customers can't sit down at your premises because that's the work site. They need to be fully vaccinated, and so takeaway services is what you offer those people, those customers, with a smile.
So this is all part of the alignment, so that the state's under the one requirement.
Yes.
And I guess in some ways, Barb, I imagine that that's also aimed at trying to manage the risk of, hopefully we're going to have lots of people visiting, but managing the risk of that as well.
Yes, that's exactly right. And I believe there is quite a big expectation that a lot of people in metropolitan Melbourne will be heading out into the regions this weekend, especially there's long and longish weekend, if you count that Monday, that mysterious Monday, that there will be hopefully huge numbers of visitors in regional Victoria, and so that's to help you manage that as well.
Barb, I think in the comments, and I certainly know in some of the questions that we're getting at Bendigo as well, there's a good deal, and dare I say some questions I just get in the chair at the hairdressers. There's a good deal of confusion around hairdressers at the moment, which I think may have come because of some changes around there. Barb, can you just give us some clarification regarding who needs to be vaccinated in hairdressers and when, both in customers and staff?
Sure, very happy to. And you're lucky to have been to a hairdresser, because I haven't. My appointment is not until the 4th of November, and I am taking time in lieu to do it. In hairdressing, beauty salons and personal care, from Friday, 6 p.m. on Friday, both staff and clients will need to be fully vaccinated. And because hair salons can't do click and collect, there's no option. If you have partially vaccinated staff, unless you can do some sort of click and collect, you can't operate as a hair salon.
Thanks, Barb. That was very clear, and I think that is probably the difficulty that's been around that in some
Yes.
areas is people just not realising
Yeah.
us getting our head around 6 o'clock Friday
Yes.
is the
Yes.
important 6
Yes.
o'clock Derby Eve, as I like to refer to
nice.
it.
Yes.
we can get that through. Got a question that's popped up in the chat box from Rinwan from one of our local restaurants, pointing out, Ms. Batterham's there, pointing out that currently, you know, the waiting times on tests are very long, and people waiting up to 3 days for test results. I don't know, Sue, you might be the one to answer this. Is it anticipated? No, it's Bruce.
Yeah, I can have a go
Sorry.
with that. Sorry, I'll just,
Bruce, are we going to look like improving on that?
So sitting in the darkness here. I don't know if that's going to help. Maybe it's not going to help.
No, it's good. Thanks, Bruce.
So the bottom line here is that, our testing system is under a lot of stress at the moment, basically because whenever we're generating exposure sites, of course, that's generating people who need testing. But unfortunately, a lot of people who don't need to be testing as well are also getting caught up in community conversations around issues. And obviously, if that's a school, for example, or a business with a large number of clients, that can potentially make a very large number of people who don't necessarily have any symptoms go and want to get tested. And across the state, we're doing over 70,000 tests a day. That compares to only 10,000 that we were doing a year ago, or that's 18 months or so ago when we started on this journey testing wise. And of course, that is creating delays. It is a challenge. One of the key issues, really, to reiterate, is that you only need to get tested if you're symptomatic or if you've been contacted. So if someone from the department has directly reached out to you, or obviously if you're a business, if you're reaching out to people and saying you are a primary close contact as far as I can tell, you should go and get tested. The rest of the family don't need to get tested. The siblings, the husbands, the people who happen to be living in the house at the same time don't need to get tested. But unfortunately, in some instances, because everyone's on high alert, they're wanting to do the right thing, they are alarmed, they are concerned, they're often being a bit overzealous, unfortunately, and it is meaning that we've got a lot of testing challenges on our plate. So the key message I'd like people to take away is symptomatic testing is the top priority. The next priority is wait until you've been contacted by someone from the public health team or directly, obviously, by a business to say you are a person who's potentially at risk. Everybody else should basically just sit and stay and wait. Obviously, if they're particularly concerned, they're free to isolate at home if that's appropriate. But certainly it is creating a lot of pressure on our system currently within Bendigo.
Thanks, Bruce. It is something that has changed over time, so that's good to know. Other thing that might be worth picking your brain on, Bruce, we talk symptomatic. What's considered to be the symptoms now?
The symptoms remain the same. So basically all of those same cardinal ones of fatigue, sore throat, loss of sense of smell and taste, all of those kind of key ones that we've been learning out still remain the same key things to look out for, basically symptomatically.
Terrific. Thank you. Some concern from some of our hospitality businesses in the chat, Barb, around their responsibilities of monitoring vaccination status, and particularly around takeaway customers. And if I summarise the questions, I think it's a bit around can they just manage that as part of their normal hospitality meet and greet management, or do they need to have a designated COVID marshal who's taking on that role?
That's a great question. That's a really good question, because that's real life. And if you're doing just takeaway, you don't have to ask about vaccination status. You only need to do the QR code check-in. So remember that when you're doing takeaway, your customer does need to use the QR code to check in, but you don't need to see their vaccination status for takeaway. If you're doing seated service, you do need to check both the vaccination status and the QR code check-in. That can be one of your staff. You don't need to hire new staff or a security guard to do it unless you're, at all. I mean, that's a business decision. I believe security staff are hard to find at the moment too. But you could use one of your staff to do that as you come in, but you do need to check everybody, because if you do have an authorised officer or one of the checks, one of the WorkSafe or the Department of Health checks who come along, they don't go around to each table and check all your clients or patrons. They will go to the business people behind the counter and ask to see the COVID safe plan, and will ask, about the checking in of the client. So, and they will probably be able to see on your QR code, scan in, I guess. No, I don't think they can actually, because they can't see that, because I misspoke then. Only the contact tracers can see that information, but they will ask you about checking people's vaccination status. So a staff member can do it, and you don't need to hire a separate person to do it, but it does need to be done accurately. So you do need to make sure that you are doing it, to make sure that everybody in your premises is fully vaccinated, who is sitting down having service. Complicated.
Thanks, Barb. Just a reminder, what age do people have to be double vaccinated to attend a hospitality venue?
So from this week, I think it's from 6 p.m. on Friday, it is people 12 years and over have to be fully vaccinated, or if a child is unvaccinated, as in a under 12 child, they do need to be accompanied by a vaccinated adult. So it's over 12.
Thanks, Barb. We've got a few of our accommodation providers on the line, and they will be very eager to dust off the cobwebs on their beautiful accommodation premises and look forward to more visitors to Bendigo. There's just a little bit of confusion though around what's the vaccination requirements for people attending accommodation venues, if you're able to clarify that.
I can do this one. It's very interesting. We've had quite some lengthy discussions with people over this, because it is probably a bit confusing, because it's residential in a way, while it's being it's also a business. So for there's no requirement to check any person who is a tenant or a visitor, as in staying and renting from you. There's no requirement to check their vaccination status, and that is, and I'll read out the list so that, and I'll pop the link in the chat as well. That includes camping grounds, caravan parks, hotels, hostels, B&Bs, private holiday rental facilities, and motels and service departments, which is pretty much everything, isn't it? So, so they don't need to. So the business owner doesn't need to check the vaccination status, but they do need to get them to check in via the QR code on the business and make sure that that's done. And there was some frequently asked questions that were updated on this today on the coronavirus website. Thanks, Marika.
Thanks, Barb. If there's any other questions, don't hesitate to pop up your hand. This is an incredible opportunity to have your questions answered directly.
Sharon from Crystalline, you've popped up your hand.
I think you'll just need to unmute yourself there, Sharon.
Thank you. I'll lower my hand as well. It was really good to hear accommodation touched on there. I am asking questions on behalf of the accommodation industry. Bendigo obviously has a lot of motels. We understand that currently there's no requirement around vaccinations, so we're fully across that one. But that does lead to the question of, I suppose, responsibility to our staff. Obviously, our staff need to be double vaxxed. We get that. But You know, we have someone coming into a room, they're potentially not vaccinated. Are we actually asking to see the vaccination status? So at minimum, we know whether it's a higher risk room or a lower risk room. How do we protect our staff from a PD? Bruce will be able to answer that with his with his understanding in terms of access into the room, keeping our staff safe. Obviously, we've got a COVID safe plan in place. We're doing COVID safe cleaning, but it's very concerning that we're going to be left at the front line and a higher risk perhaps of exposure. Obviously, people stay with us for a long time as well. So if we do have a positive case, we've got others staying with us at the time. We really want some guidance, and we found that the accommodation sector seems to be lacking in information and guidance. It seems to be a bit of a forgotten sector, a little bit in terms of what to do and how to manage it.
Sure, I'm happy to lead off, and I think Barbara might talk a little bit more about the specifics, Sharon, in relation to motels. But as a broad public health piece, if your staff are double vaxxed, that's incredibly important. Secondly, as long as they continue to practice their overall COVID safe behaviours, and that could include mask wearing, obviously physical distancing, hand washing are really important components as well. If they're double vaxxed and if they're doing that, the risk to them on a personal level is going to be really very low. We do know that there are a lot of infections that people get even when they're vaccinated, but when they're vaccinated, the likelihood of that being severe is extremely low. In many instances, it's going to be basically for someone of a working age, very minimal risk, particularly if they're already double vaccinated. I know that that's not no risk, but unfortunately we're living in a kind of we've got no scenario where any of us are living in a no risk environment. None of the vaccines are absolutely 100% effective yet. They're the fastest vaccines ever to be produced in human history. So doing an incredible job and definitely reducing hospitalizations and severe illness. So if your staff are fully vaccinated and practicing COVID safe behaviors, I think they are well on the road to working in a very COVID safe manner. But I'll hand over to Barbara for any of the specifics on the motel environment particularly.
Thanks, Bruce. I think, was it Fran? I think it's about in your COVID safe plan, it is putting in place some specific COVID safe practices that you will do in the business as well. About you might be able to do contactless food delivery to that person if you because you're not checking anyone's vaccination status, you don't know if anyone is unvaccinated. So I think it's about making sure that your service delivery within the motel or the business, the accommodation business, is as contactless as possible, regardless of a person's vaccination status, really. And to perhaps, put in place some business requirements about if you're going to change a room or something like that, making sure that there's plenty of ventilation before the staff go in. So if you can open, windows and things like that, make sure. You might even ask if windows are able to be opened, ask your customers to open the windows as they leave, something like that. Just if you think through the process that a person has to go through to leave a premises or be in a premises, that you have to maximise your ventilation of the room and put in place those practices. But I appreciate that it is difficult for accommodation, but it's a little bit like access to food. We can't deny people access to shelter. So.
Sorry, Barbara, Marika, I hope this is okay if I just do a quick follow-up question. We're being advised, and even today during a meeting with industry leaders of AHA, that we're needing to make a decision over the next few days as to whether we, as an accommodation provider, are going to insist on our customers being double vaxxed or not. And if we make that choice, we then put it out to the community that we are a double vax centre, and that's what we're choosing to do. I'm getting the sense from you that you'd almost suggest that's not an appropriate process.
No, not at all. No, it's a business decision ultimately. It is absolutely your right to make rules about who comes into your business.
Okay, because I suppose the other concern is that transfer of someone who has been vaccinated, someone who hasn't been, and if the staff member goes through the rooms, are we making someone who's perhaps medically unable to get a vaccine higher risk because we're allowing unvaccinated guests to stay in nearby rooms?
Yeah, ultimately it is your decision about what who comes into your business, and that goes for any business. So,
okay, thank you.
I will also I'll jump in here and I'll share a quick slide. We are looking to run some business forums in the coming couple of weeks, which are specific for industries. Barb will be in attendance, but we will also look at some of that more tailored information to your business. I've popped a slide up there about some of the dates. That list will grow for other industries as well as we touch on them, and I'll pop the details into the chat as well. But I do encourage you to register and come along. That might help with some of the more granular questions that are specific to you. We understand that forums like this can be a bit convoluted trying to pick out the information. So yeah, we'll be looking to run those in the next couple of weeks.
Thanks, Fran. I forgot to do the promotion.
Thank you. Hopefully we haven't been too convoluted.
No, it's just very complex. I know, it's so complex, isn't it, when you're a retail business or some poor, I'm sure there's some poor real estate agent sitting back there going, oh, I don't understand. So yeah, please do reach out to us. That ICC email is also on that slide pack from Barb as well, so we can answer questions.
Absolutely. Just as we do conclude, because we are at time, I do see a couple of other questions that I think would be of interest to most people in the chat. And I think there's a little bit of confusion around the obligation of an employer to be able to provide the information of who was in the workplace on a date of exposure. As Sue mentioned, that is some of the information that the contact tracers would be making in order to make their determinations about who's a close personal contact. But I think that's a little bit confusing when you then have the QR codes as well. Barb and Sue, am I right that the expectation is that an employer is not getting that information from QR codes? They'd be requesting their staff to use the QR codes because that would help the contact tracers, but it's a separate obligation of an employer to provide a list of who was working that day.
That's right, Marika. If there's a sort of a traced transmission in the workplace, yes, that list will be sourced from the business owner, but staff should check in on the QR code app as they come in the door every day.
Yeah, Barb, I know with mine, I'll check in on the QR code if I'm, on those rare occasions on one of the 10 in the office. We'll be glad to see that gone come Friday. But I generally check back, make sure I'm checking in the office, partly because I think, and Sue, I might be wrong with my amateur contact tracing, but I think that could be really useful if the coffee shop I'd just been to was an exposure site, that there would then be that chain that I can say, oh no, I left that at that time because I'd checked back into the office at this time. So sometimes that story, and don't you love going back through your history of your QR codes to see where you've been, that story I imagine would be really useful to Sue and her team in the contact tracing. Being Bendigo Cup Eve and the eve of a public holiday, I must thank you all for taking this time to meet and hear of these things. And hopefully that's provided some information that is useful for your business. There's a number of resources that you can turn to if you are finding navigating these things difficult, or that there's particular instances that are a little bit hard to figure out for your particular business setup. This evening was organised by our local regional development, Victoria, and the ICC email is in that chat. But as an easy point of contact, if you did have any questions or wanted to be put in touch with the right people in the department, certainly reach out to Bendigo and we'll be able to assist you with that. City of Greater Bendigo are also able to assist, particularly just through their business assistance, but probably Bendigo would be an easy way to look at that as well. I know we've got Councillor Jen Alden as Mayor and Councillor Margot Rourke on the line. Councillors are often good people to point you in the right direction of these things as well. It's all about also being in it together, and so certainly having a chat through your different industry is often useful as well. Can I also, none of this is easy for all of us to navigate. Don't forget that Bendigo also has the wonderful Shami providing counselling and other mental health support. If you or your staff members are finding this difficult, certainly reaching out to Shami, who can either provide support directly or refer you on to appropriate services, is really worthwhile doing. And keep an eye on the Bendigo newsletters as well. Shami's got a great presentation coming up soon about dealing with challenging customers, which if you or your staff are worried about the potential of aggravation around some of these issues, that's a great session to tune into as well. But Shami's also available to provide bespoke presentations or discussions with your individual staff, or perhaps your a collection of businesses in your geographical or industry area as well. So hopefully for those who have a public holiday tomorrow, please take the time to have a little bit of a break from all of this. I think Bruce can reassure us that we don't need to watch the numbers too closely tomorrow, and Sue will get in touch with us if we're an exposure site. So please take a break from this pressure. If you are working tomorrow, I hope it's a good business day for you. And otherwise, I look forward to seeing you at future Bendigo events and to assisting you and your business, because I'm really looking forward to an exciting and positive time for business in Bendigo going forward. Thank you, and thank you to our presenters as well.
Thanks, Marika. It's a pleasure. And Bendigo is a fantastic organisation.